I'm here at the annual meeting of the North American Menopause Society, and I am talking with
Pauline Maki, Professor of Psychiatry and Psychology at the University of Illinois at Chicago.
Dr. Maki has just completed her year as president of this organization and has done a stupendous job. She's also been the program chair here. And, you know, women often say they're afraid that with menopause they're losing their mind. As a matter of fact, my mother said, of all the things I've lost, I miss my mind the most. So maybe you could say, what's normal, what's not, how do you know?
Yeah, I think this is really important to discuss because many women fear that when they're experiencing these new lapses in memory and then when they're experiencing this mental fog, geez, is it Alzheimer's disease? What's happening to my brain? So the first thing that we should do is reassure women that cognitive changes during the menopausal transition are normal. So about 62% of women report that their memory isn't as good as it used to be. And in fact, when you objectively measure cognitive performance by having women complete cognitive tests, paper and pencil tests, they do worse as they transition through the menopause. It appears as though it bounces back though, which is good news because it suggests that this might be a temporary phenomenon. I will say though that not all women experience cognitive declines during the menopausal transition. For some women, they transition through without any cognitive problems. For other women, however, it's their main complaint. It's the thing that bothers them the most. Why? Because studies have shown that complaints of forgetfulness, difficulty concentrating, as well as depressive symptoms and anxiety are the key predictors of quality of life at work and quality of life in relationships.
So they don't feel as good about themselves, and perhaps that affects relationships.
That's right. And they don't feel like they're able to perform as well at work because they're kind of living in a mental fog occasionally. And these symptoms can wax and wane as well. What are they like to women? Cognitive complaints are often in the domain of memory, but in terms of what women experience, they can't remember, what was his last name? What was the name of that movie we just saw? Who was that movie star? And they react a little anxiously because they want to make sure that this isn't something that pretends Alzheimer's disease. So that's a very common one. We call it the tip of the tongue phenomenon. There's something there, we just can't grab it out. And what you find is that after a little while, sometimes that name will come back, sometimes the name of the movie will come back. Sometimes that's what women mean by memory, and by the mental fog, they just aren't multitasking as well. Somebody will ask them 2 questions and they'll remember the first one but not the second one, or they'll walk into a room and say, what was I going to do in here? So the mental fog and the memory complaints oftentimes appear or become manifest in these kinds of examples. So these are upsetting to women, but be reassured that these are normal. Dementia is very, very, very rare in the 50s and 60s, especially if someone doesn't have a parent who developed Alzheimer's disease in their 50s. So rest assured, recognize it's part of the normal aging process and that we think they bounce back.
Thank you very much.
You're welcome.